When examining the root causes of obesity, it's tempting to focus solely on personal choices, what individuals eat, how often they exercise, and how much willpower they have. But this narrow view ignores a far more powerful influence: the environment in which those choices are made. In truth, many decisions about food and physical activity are not made in a vacuum. They are shaped, restricted, or even dictated by a person's surroundings, especially when those surroundings are defined by socioeconomic disadvantage. Access to affordable healthy food, safe places to walk or play, time for meal preparation, and even exposure to green spaces all influence whether someone is likely to gain weight or stay metabolically healthy. And when these environmental factors are lacking, even the most motivated individual faces an uphill battle. One of the most significant issues is food access, or more accurately, food inequity. In many low-income neighborhoods, the local food environment is saturated with fast food outlets, convenience stores, and liquor shops. Fresh produce, lean proteins, and unprocessed staples may be available only at higher prices, in limited varieties, or at locations far from residential areas. This leads to what public health researchers call food deserts, places where nutritious options are scarce or unaffordable. Even more insidious are food swamps, where unhealthy food options outnumber healthy ones by an overwhelming margin. In these environments, choosing a wholesome diet is not just difficult, it is structurally discouraged. Families facing financial stress often gravitate toward calorie-dense, processed foods not because they are unaware of better choices, but because these options are more affordable, more shelf-stable, and more immediately satisfying. A bag of chips, a frozen pizza, or a bottle of soda offers more calories per dollar than a basket of vegetables or a piece of fresh fish. And when a parent is working two jobs, has no access to a full kitchen, or lacks the time or energy to cook, fast food becomes not just a temptation, it becomes a necessity. This isn't about laziness. It's about survival in a system that prioritizes corporate profit over public health. Beyond food, the built environment plays a crucial role. In many neighborhoods, particularly those affected by poverty and historical segregation, walkability is poor. Sidewalks may be broken or non-existent. Streets may be unsafe due to crime, traffic, or poor lighting. Parks may be few, poorly maintained, or occupied by illicit activity. In these environments, encouraging regular outdoor exercise is not just unrealistic, it's dangerous. Contrast that with wealthier neighborhoods, where bike lanes, clean parks, and community centers are the norm. Here, physical activity is not just possible, it's designed into daily life. The consequences of these disparities are visible in public health data. Obesity rates are consistently higher in areas with lower socioeconomic status. Children growing up in under-resourced neighborhoods are more likely to become overweight by adolescence, and adults in these areas are at higher risk for diabetes, heart disease, and premature mortality. These trends are not random. They are the predictable outcomes of an environment that erodes health at every level, nutritionally, physically, and psychologically. There is also the factor of time, another resource that is unequally distributed. People with long commutes, multiple jobs, or caregiving responsibilities often lack the time required to shop for groceries, prepare balanced meals, or engage in regular exercise. Health takes a back seat to immediate obligations. Stress levels rise. Sleep quality deteriorates. And in this high-pressure environment, the body becomes more prone to weight gain. Chronic stress elevates cortisol, which in turn increases appetite, reduces willpower, and promotes fat storage, particularly around the abdomen. It's a physiological survival mechanism triggered by social and economic instability. It's important to issue a warning here. If we continue to frame obesity as a purely personal issue while ignoring these environmental and structural barriers, we will never solve the crisis. Worse, we will continue to shame and blame individuals who are simply reacting to the circumstances they live in. Health does not begin at the gym or in the kitchen. It begins in policies, city planning, transportation systems, housing security, and school nutrition programs. Without addressing these systemic issues, most interventions will only reach those who already have the privilege of choice. Yet within this grim landscape, there is hope, but it demands bold, collective action. Urban renewal projects that prioritize walkability and safety can transform physical activity from a chore into a natural part of life. Subsidies for farmers' markets, community gardens, or grocery store development in underserved areas can increase access to real food. Workplace policies that support family time, Flexible hours or wellness incentives can reduce stress and improve overall health. And perhaps most critically, public education campaigns that respect cultural norms while promoting nutritional literacy can empower communities to make informed decisions without shame or judgment. At the personal level, people who recognize the influence of their environment can begin to take small, strategic actions, such as batch cooking when possible, using online grocery services for better access, seeking free or low-cost fitness resources, or joining community health initiatives. But these efforts must be supported by a society that makes health an accessible default, not a luxury. Obesity is not just a medical issue or a moral one. It is a reflection of the environment we've built and the systems we've allowed to persist. Until we confront that reality, our solutions will remain incomplete, and the burden will fall most heavily on those with the fewest resources to bear it. True progress requires that we build a world where health is not the exception, but the expectation, not for the few, but for all.